by Dr. T. Senthil sir on teleophthalmology and business models.
Dr. Manoras, Navatika, you are please do come, panelist. Navatika's panelist.
Can I start?
No, come here, this side.
Thanks for the few of you who decided to come for this session rather than going to Rishikesh or Haridwar. So, I think, and thanks to the non-speakers, because most of the sessions I think we have a lot of speakers who are more than the audience. So, a lot of things start very small, and even the biggest of the ventures and biggest companies, biggest organizations, they start very small. And I think this small gathering will definitely within 3-4 years will become one of the largest gatherings for teleophthalmology. And incidentally, when I don't know how many of you attended the inaugural speech by G.N. Rao, where he also focused on the importance of teleophthalmology during his talk. And definitely teleophthalmology is not something which is for only the bigger organizations, because we always think that teleophthalmology should be done by institutions and not by individual practitioners. But I think teleophthalmology can be very much applicable to all the individual practitioners also. And over the next 5-6 minutes, I will tell you what I have done. I have made a successful business model out of teleophthalmology in the last 7-8 years. And so maybe it can be applicable to all of you also. And we had a lot of discussion with Dr. Subudhi as to how to improve the membership for Teleophthalmology Society. I think the members will improve when there is a business model, when there is a possibility of getting more patients out of telemedicine. And I think telemedicine is here to stay, and even the government of India is very much supportive of telemedicine. So the difference between market takers and market makers, there are two different kinds of people. Isn't a product innovation, but it's just business model innovation. Basically it means like how do you execute it? So you don't have to do something new for this thing, but basically how we can execute it. And teleophthalmology is nothing but execution, because we already have the knowledge of ophthalmology and screening and everything, and the execution is the part which we all have to focus on. So, and I am sure regarding the legality, the telemedicine practice guidelines by the National Medical Council has been a boon, so that a lot of people had doubts whether telemedicine is legal or ethical and all these things. But with the telemedicine practice guidelines coming into play during the COVID time, I think that doubt has been cleared, and everybody can officially practice telemedicine. And in fact, the government of India is also doing telemedicine. So there is no need to worry about the legality or all those things. So what are all the different types of teleophthalmology? One thing the first thing is direct to patient teleconsultation, like the patient calls you on a video call or through a software, and then you provide a consultation. Second thing is teleophthalmology in association with other healthcare facilities, like you as an ophthalmologist can have a hospital and you can collaborate with the surrounding general hospitals, diabetes centers, all those providers. Third thing is mobile vans, where you would have seen the large vans by organizations like Shankara Nethralaya, which is going into the community to screen. Vision centers, I am sure now many of the private practitioners also are trying to establish vision centers to reach out to the people who are not able to come to the hospital. And more importance, many organizations have been successfully doing diabetic retinopathy screening, and ROP screening also can be done through teleophthalmology. So these are the different ways in which, as a private practitioner or a smaller player also, you can do teleophthalmology. And I will give you my so this is the direct to patient teleconsultation, where a patient calls you and then you talk to him about a second opinion and other things. But in ophthalmology, there is a limitation in direct to patient teleconsultation, because you need details like visual acuity, you need anterior segment pictures, you need fundus pictures. So There are a lot of limitations. It's not like a dermatology or a psychiatry, but whenever you are doing a direct to patient teleconsultation, might be limited for ophthalmologists. So we don't actually do a lot of this direct to patient teleconsultations. So these are the limitations, and it can be you can even maybe some of the hospitals have given a link for the direct teleconsultation on the hospital website. So if somebody wants to contact the doctor before he actually comes, just to send his reports and have an initial opinion, then maybe this will work. And it's mostly offered free of cost, just to get patients to the hospital. And there are various software platforms which are available for this, and mostly it can be considered as a marketing tool. Suppose say somebody from UK wants to visit your hospital, but he just wants to talk to the doctor before he actually comes, or send some basic information about his details. I think direct to patient teleconsultation works in that way. And I think the most interesting or successful would be where you work in association with another healthcare facility, where you can actually set up a teleconsultation center in a diabetes center or in a general hospital, and then maybe there is an optometrist there who does the basic refraction and anterior segment image, all those things which are uploaded. This works slightly better because you have more information about the patient before you actually screen. So it's basically like you set up a teleophthalmology center in a general hospital, and you have a patient pool which is already there in the hospital, and consultation and opticals income can provide you revenue generation opportunities. And if there is a referral, it can also improve your surgical revenues. Diabetic retinopathy screening can be done in a similar way. ROP screening can also be done. So this is teleophthalmology, how it is done using these mobile vans, but mostly these are considered a charitable kind of a model, where you have the funding, and then mostly done by bigger organizations, and then the cost of the vehicle, maintenance, financial viability might be questionable unless you have a funding resource for this kind of a project. So if you have funding, you can go into a mobile kind of a model, but otherwise I think it is not viable for a private practitioner. So this is the high cost of equipment, there is recurring cost, charitable funded projects, and patients may not be willing to pay because it is seen as a charitable, and mostly you can get the revenue from the optical shop. So this is something which I would like to focus on, is basically what I have been doing for the last 7-8 years, where we set up these fundus cameras in diabetes centers and or general hospitals. So any ophthalmologist who has a hospital, say doctor is in Barampur, so he can identify 10 diabetologists or 10 general hospitals surrounding his clinic, and then set up these fundus cameras. And there are a software platforms. We in fact created our own platform where we train the staff in those centers to take these images, because it's non-mydriatic, so any staff can be trained. There are reasonably good quality Indian cameras like 4S and Remedio and all these cameras, where you can train the staff in that particular center, and then so maybe I can take some time now, sir. So then images get uploaded, and you can use an ophthalmologist to kind of report those images, and patient gets a report. And whoever is normal can be called back after 1 year. Whoever has a problem can be referred to your hospital. So this kind of a network can be seen as an opportunity to get patients into your hospital, and patients also pay for each screening, and this is a financially viable model. And I have been running almost 300 centers now all over India, and every day 1000 to 1200 patients keep coming in. Just like teleradiology, teleophthalmology definitely has a role. And if you are if you run a private hospital, or if you are a retina surgeon looking to improve your patient pool, definitely this kind of a screening model will work. And financially viable model out of all the models, if you can execute it properly. And I'm sure this can be taken up by TOSI, where they can motivate other private hospitals to kind of organize these screening centers. And because so many, the volume of diabetes is so high, 300 locations is not enough. Maybe we need 3,000 or 30,000 locations to screen all diabetic people. And if 20,000 ophthalmologist members of AIOS, even if 3,000-4,000 of them take up this, launching 10 locations, I think there can be 30,000-40,000 locations which can be, and we are ready to help, and we would be happy if you want to know the model or if you want to know about the platform, all those things we are ready to support through Teleophthalmology Society. So this is the business model which I just explained, and the diabetologist, here any model to be successful, I think everybody has to benefit. So the diabetologist or the physician, he gets paid for the reporting, and then ophthalmologist gets benefited either by the reporting charges or by basically getting more referrals into the center. And patient also gets benefited because he gets screening at the level of diabetes center. He doesn't have to visit the ophthalmologist for a normal checkup basically. So this increases the number of patients coming into the ophthalmologist. So basically a lot of patients, I am sure, even with advanced retinopathy, are still not going to ophthalmologist. So the more number we screen, more number of patients will come to the ophthalmologist. So that's the idea. So, and retinopathy of prematurity screening, large scale, it's done by Narayana Nethralaya and a few other organizations, can also be seen as an opportunity. Now it can be done through telemedicine, where the images get transferred online, and then you can have an ophthalmologist or a retina surgeon looking at those from a remote place. So these are the newer equipments. This is a company called Globe Check, which has come with a globe model for retinal screening for teleophthalmology, where all the equipments are placed inside a globe, including an OCT, and patient can go get self-screened and then get the report. And there are vision checkup kiosks like these, where you can get your refraction done. So there are companies which have come out with the vision checkup kiosk like these, and maybe if you are a private hospital looking to establish or market your hospital, these kind of kiosks you can set up in public areas, supermarket, and this is a company which has come up with kiosk. And vision center, I am sure all of you are also exploring that model of setting up a vision center and then getting patients from those vision centers. So the most successful are the vision centers of Arvind and LV Prasad. And sir also mentioned about teleoptometry, because India has, I think, 200,000 plus optical shops where good quality optometrists are not available. So if you can kind of set up a teleoptometry facility where a centrally located optometrist is there.
Yeah, now it's I think time now. That's something now you conclude.
Yeah.
Yeah, all the speakers have already joined with us.
Yeah. So I am almost done, sir.
Yeah, please.
So these are some online visual field testing, a lot of developments in anterior segment imaging. Artificial intelligence is coming up in a huge way in ophthalmology, and yeah, these are my contact information. Thank you, sir.
Thank you, sir. Thank you for giving the good account